Alex Chemarov here. Another restorative segment where we're going to focus on the posterior hip. So making our way around from different stations throughout the body. The posterior hip, or think like the back butt, right? We focused on the front butt in the previous 2 weeks. But focusing on the butt, the deep glute, like the lateral hip rotators, very, very common impingement site, and we see it expressed a lot of different ways. Somebody who's really ducked out with their feet, you know, super tight into the hip, the inability to internally rotate, which poses a big, big challenge on the structures like the knee, the lower back. The posterior hip is a common impingement site for someone who has sciatica. So any electric type symptoms shooting down the leg, this could be a common area of impingement. So when we look at like the fan of the hip, essentially if we remove the glute underneath it, we have a bunch of muscles like the piriformis, very common. Then there's the gemelli, the obturators, and the quadratus femoris that all run like a fan on the posterior hip. So as we start kind of rolling, it's going to be helpful to know some of those structures in there. All right, and the sciatic nerve actually runs through them, so it can actually get scissored and pinched off, which is one of the big impingement sites where the piriformis comes into play. So to hit it, starting kind of mellower, level 1 would be to using a foam roller. I'm using a 3 foot long. You could also use a 1 foot, either or. And whichever glute you're going to be on, you're going to cross the ankle on the opposite knee. And that's just going to expose the hip, if you will. And I'm just going to make my way on the lateral hip, kind of upper, outer part of my butt. All right? And you can just kind of, like all the other areas that we've rolled, just kind of search and destroy, see and find the tissue tension. And that's where you're just going to want to kind of make your way, see what you find. All right? Very often you'll find right to left side discrepancies depending on what kind of symptoms you have and what's going on in your body. So just make your way around, turn the other cheek, hit both sides. All right, and this might not be too bad. If you want to get more aggressive, lacrosse ball. So lacrosse ball kind of level 2. I recommend going against the wall. So I'm essentially going to look to roll. Remember how those tissues run like a fan horizontally. So what I'm going to do is I'm going to put the ball against the wall, and I'm just going to start making my way down across my upper butt, making my way kind of from my hip bone, you know, where my femur inserts, and towards my sacrum, towards my crack. And you can put as much weight on there as you can tolerate, and then you can also change the height. So pick one line, make your way from outer towards your back, and then you can lower it down, and you can start, again, finding where you hold the tension in your body. All right, so you can hit both sides that way. Level 3, the most aggressive and sadistic would be to actually lay on the ground. So I'll go and show you my left hip. So position right on that lateral hip, and you can just allow the weight of your hip and body to relax onto the lacrosse ball. And now from here, I just take my pelvis and twist and try to just kind of fall right into that lacrosse ball, so you can allow that ball to penetrate into those tissues. It can be very, very painful and aggressive depending on how restricted you are. One word of caution: if you do find any numbness and tingling that is shooting down your leg, that's your sciatic nerve, don't stay on there. Definitely avoid that area and work the areas kind of around that area so you can restrict that sciatic nerve. In the coming weeks, once we kind of get through all these soft tissue segments, I'm going to shift gears and we're going to go more to a local mobility type of strategy, where that will be where we continue kind of our progression from soft tissue to mobility and then to activation. So I've been taking a number of weeks and months just kind of going through all the soft tissue areas, and then I'm going to backtrack and we're going to go through all the mobility, and then we're going to go through some activation type stuff. So just to kind of give you guys a little snapshot as to where we're going with all these different segments. So enjoy or not, it's definitely going to be tender, but this is a huge one for many, many clients, especially now that it's getting warmer. All you golfers out there, the posterior hip, this is a major, major area of dysfunction, because as a righty golfer, I need to get into this posted position where my my upper body turns, my foot ideally is fixed, and my hip is put into a position of internal rotation. So that lateral hip, those deep hip rotators need to be able to load and lengthen. So this is a big one. If you have any questions, don't hesitate to reach out. Thanks so much.